Good morning. I am Enrico Ascher. I'm a professor of surgery at NYU, and also I'm the co-chair of the VEITHsymposium. Well, there are many benefits to TCAR, as we call it. The one very attractive aspect of TCAR is that it is a neuroprotective flow reversal during the placement of the stent. So whatever plaque is dislodged, or any junk that goes in the carotid artery is being sucked in, filtered, and then the rest of the blood goes into the venous system. So this is a very attractive concept, which was developed by Dr. Juan Parodi. The other aspect that's advantageous to TCAR is that you make a small incision in the neck, and you're able to bypass all the potential hazards of a very diseased aortic arch, or very tortuous aortic arch. So all this is being eliminated by making a small incision at the base of the neck for about 2 centimeters. You get the common carotid artery, and then you place the sheath. And from there, you have already a flow reversal, since the other portion of the device is placed into the femoral vein. So those are the main advantages: the flow reversal and the fact that you bypass the aortic arch. The Mini-Incision carotid endarterectomy was developed by me in 2002 when I had a patient with a very thin neck, and she did not want to have a long incision in the neck. She was really adamant, and she asked me if I could do anything to make a small incision rather than a long incision. So of course, I didn't want to jeopardize her health, and I had to do something that I felt was very safe while making a small incision. So I thought about using the ultrasound to delineate the site of the plaque, where the plaque is exactly, most probably at the level of the bifurcation of the carotid artery. But most surgeons, and the way standard endarterectomy was developed, was because with a long incision is because we don't know what the bifurcation of the carotid artery is in the neck. It can vary dramatically. It can be just at the level of the jaw, or it can be all the way very down close to the clavicle. So that way, using an ultrasound, you can delineate exactly where the plaque is in the internal carotid artery. And also you can follow it proximally and see how far it goes. So you make an incision right over that area, and within 1 inch incision, in 85% of the patients, you can remove that plaque instead of making a 6 to 9 inch incision. So that's how we started. And I published this paper, the first paper with over 200 cases, in the Journal of Vascular Surgery, all the way back in 2005. It has been taking some time for the procedure to pick up, but slowly picking up. Like, many of the things that we develop takes about 20 years to become popular. But I think mini-incision carotid endarterectomy is certainly a safe alternative to all other procedures, including standard endarterectomy. Now, just to make sure that I am not speaking in the name of the VEITH organization or New York University, this is all personal opinion, and some of it is based on my personal experience and not necessarily on published data. Like we said, it's cheaper. Why I believe mini-incision carotid endarterectomy is cheaper is because it's a knife, basically. It's a blade instead of an apparatus that is much more expensive. But I have not done a prospective study to evaluate actually the overall cost. It's just a feeling that if you use a blade that's very cheap in comparison to a TCAR apparatus, that the procedure is going to be safer overall. And hopefully this will be shown in the future.